Joanna from Apple Joe Farms, Modern Homesteader. This afternoon, I thought you might enjoy visiting a little bit about a subject that we get many questions on, and give you a chance to take a look at, hi baby, to take a look at Sammy and Archie, our 2-week-old twin bucklings. They're just starting to eat hay, as you see, and oh yes, having lots of fun. Well, I have adopted the method of usage of the CD&T vaccine that Dr. Kennedy from Pipestone Veterinary has written about in his book. And he has been a veterinarian for over 55 years, and his practice has always been heavily on the side of treating sheep and goats. And so he makes some wonderful discoveries through his career and has worked with people internationally in this field. So I really feel like he's someone in the know. So Dr. Kennedy mentions that he's seen, perhaps some confusion by suggesting a change in the way that we control enterotoxemia and tetanus in sheep and goats. As we know, for years, the accepted method has been to vaccinate the does prior to kidding. And we know that this procedure has been meant to protect the doe when she receives extra grain after kidding, and also to protect the kid from enterotoxemia and tetanus. So the question is, what is the best way to administer and when? And he indicates that, of course, the cheapest source of tetanus toxoid has always been CD&T, and he talks about how that he has incorporated that with penicillin, and really a plan that he follows through his career has been born. And this is what I've begun doing, and it just makes total sense. So the recommendation is for your kids at the time of birth, 1 cc of the CD&T mixed with 1 cc of penicillin and given sub-Q. There's a lot less tissue damage when it's being given sub-Q over the rib area, and to do so shortly after birth. Now, a couple of things that this accomplishes, and we know that we've always been told that as soon as our babies are born that we need to treat the umbilical cord area so that none of the bacteria, no problems occur there. Well, he indicates that actually these solutions that people dip the umbilical cord after birth in actually do no good at preventing these problems. However, by giving the CD&T with the penicillin, 1 cc of each, shortly after birth by injection to all of the kids, this is going to really help to take care of any kind of infections and anything with a bacterial infection problem. So that's what I've been doing with success. Now, some have asked in regard to the CD&T toxoid if we should be perhaps using the I believe it's called Clovexin 8. It's a more expensive form of the CD&T, And really, there are 4 organisms in that vaccine. But in the upper Midwest, such as where I live, and on up through Minnesota, Iowa, and those areas, in all the years that the doctor has practiced, he mentions that he never diagnosed any sheep or goats over 55 years with any of these problems. So unless you know differently, that you actually need that vaccine, it is just fine to use the CD&T or the CD with spur. Well, I hope that that has helped, and certainly if you have any questions, please feel free to send them to me at applejoefarms@gmail.com. You can also text me 417-665-8996. And let me know that you have some questions or even suggestions. That would be great. Please stop by our website, applejoefarms.com. See these little guys? They still have not been placed. They're just a little over 2 weeks old. The plan is for them to go castrated as pets, and they are very reasonably priced. And the beauty of all this is that we've worked very hard on socializing Sammy. Hello, Sammy. And this is their first week outside, so it's very special. And there's Archie. He's all chocolate and moon spotted, and you're just a wonderful little boy, aren't you? And so, hi there, baby. Yeah. They're on a shared program with their mother, Maisie. This is Maisie. And she feeds them, and they get to be with her all day long. And then they get a bottle at bedtime. Yeah. They get a bottle at bedtime. And so they can go to their new home at any time if you want to continue feeding them. Hi, baby. Feeding them on the bottle at home. Again, thank you so much for joining us.